You're going to hear things today people don't often talk about. You'll leave with some inspiration, some uplifting insights, some tips, maybe even some courage. You're going to hear from people who've been there. This is Ford Warriors in Pink, Warriors Moving Warriors. I'm Lila Lazarus, and in honor of Breast Cancer Awareness Month, we're talking about breast cancer, but today in the sea of pink you see everywhere, we're going to emphasize a little splash of blue. We know that breast cancer is most often found in women, but men get breast cancer too. So when we ask you to go out and go to FordCares.com and help in this fight, we do it for breast cancer warriors, women and men. The net proceeds, they're dedicated to finding transportation solutions for our warriors. Now, two of the people I'm talking to are men who never thought they'd be talking about breast cancer, let alone turn into breast cancer survivors someday. Michael Singer, who's wearing the True Warrior polo. Hi, Michael.
Thank you for having me.
And Bret Miller, wearing a very comfy unisex Warriors top, supporting the cause. Hi, Bret.
Hi, Lila. Thank you.
Both are ambassadors for Warriors in Pink. And we also have Bret's surgeon, Dr. Lon McCroskey, wearing the Warriors in Pink tie, which has a little blue with the pink. Hi, Doc.
Hi, thanks for inviting me.
Bret, I'm going to start with you because we know the majority of men who are diagnosed with breast cancer are usually in their 50s or in their 60s, but you were 17 when you found a lump?
Correct. I was 17. I was going into my senior year of high school when I was, just a normal day, kind of sitting there watching TV, and I kind of did this like stretch back and then, kind of scratch across, and then I felt this lump. I had two different doctors. Basically, both of them told me that it was a calcium buildup. I was going through puberty; it would dissipate and go away. And it wasn't until I was 24 where I finally, with health insurance and finally having it through my job and going to just go get a physical, because it had been so long since I had, almost about 7 years since I'd had a physical. I had to pretty much stop the doctor before he was done with all the normal tests for a male during physical, and asked about the lump. And that's when he immediately set me up to get an ultrasound.
Did you ever in your wildest dreams think you could get breast cancer?
At my age, no.
And so often men get the lump, don't believe breast cancer is going to happen to them. Michael, I think you had a lump that you actually ignored and only asked a doctor on a whim, right?
Correct. I had been feeling this lump under my left nipple, and I was ignoring it, but it was there. And I had mentioned it to my wife, and my wife said, you should get that checked out. And I actually went to my doctor's office for a routine physical, and believe it or not, I was embarrassed to tell him I had a lump under my nipple, and went home. And my wife said, what did the doctor say about the lump? And I said, I was embarrassed. I didn't tell him. And she got pretty upset with me. And the doctor's office called the next day and said they wanted me to come in for further blood work. And I went back to the doctor's office that day only to find out that the blood work showed that I was diabetic. And that's when I said, Doc, while I'm here, I have this lump. And it raised a red flag with him because my sister had breast cancer 2 years earlier to me, and he knew my family history. So he sent me right away for a biopsy.
You mentioned your embarrassment. Even women have embarrassment talking about this. For men, it's especially difficult. How did you get over that?
For me, it took me a while to get over the embarrassment. I mean, after they sent me for the biopsy and the biopsy came back positive for breast cancer, I felt the stigma that only women get breast cancer, the misconception that this is just a women's disease, and the misconception that it only affects older men. Once I got over that, I just didn't really want to tell anybody that I had breast cancer. It was hard to say the word breast cancer. I was one of those people who called it chest cancer in the beginning to throw people off, because I thought I was a freak in the beginning. And believe it or not, it wasn't until I had seen Bret Miller on a TV show in New York City that I actually got the courage to tell people I had breast cancer and actually get into the advocacy world.
I love when courage inspires courage. Bret, how did you get that courage to get on TV and to go around the country and to talk to people about male breast cancer?
It's funny because he's actually here with us right now. It's Dr. Lon McCroskey. It was in meeting him and him going through the process that was coming up, all the steps with the mastectomy, the possible double mastectomy, which I luckily was ended up with only single mastectomy. But the double mastectomy and then the treatments and everything going on, and him telling me that he had performed the surgery on at least a dozen other males before me. He saw something in me and told me that if I was willing to share my story with my age and my diagnosis, and if I was open to speak about it, that he could see me being a face of male breast cancer and helping others out. And just right there is when I made that decision that that's what I was going to do.
Dr. McCroskey, why was that so important to you, that there was a mouthpiece for younger men to tell people what is possible and what could happen?
Well, I had seen quite a few male breast cancer patients, and I did recognize that there's a stigma, if you will, and a reluctance on the part of the patient to acknowledge that they have this, and even just to seek out medical attention is difficult sometimes. And I saw something in Bret and his mother Peggy and his father Bob. I could see that they were close, and that they could bring a powerful message to others if they were willing to do that.
Doc, I want you to talk for a moment to the people who may be listening who could have the risk factors, who may have that lump, who may have some sort of discharge, who may be too embarrassed to talk to a doctor or go in and seek help. Can you convey the importance of following up on those first signs as soon as possible?
Well, it's very important. And, we all need to be aware of our bodies. We encourage breast exams by women, self-exams, and also men. Men should be willing to touch their breasts and feel if there's a change or a lump, if there's a discharge, if there's tenderness or pain. These are all warning signs.
What about family history?
It's super important, Lila. And we are increasingly aware of how important the family history is for putting patients at risk for cancers. We know a lot about breast cancer risk with genetic mutations, such as the BRCA1 and BRCA2. And we know also that any man with breast cancer in a family is a major red flag for that family to do genetic counseling and genetic testing.
Michael, let me ask you, you get breast cancer, you're diagnosed, you start this journey or this fight or this battle. What was your mindset? What was your experience?
In the beginning, as I mentioned, I felt like a freak, and I didn't talk to other people about it. And when you researched online, this was back in 2010 when I first got diagnosed, there was nothing online. None of the major cancer organizations had anything about male breast cancer on their websites. And thankfully, that's changed over the years. But I have to go back to staying silent until I saw on a TV show in New York that gave me the courage. When I saw these guys talking about breast cancer, it was like my head exploded. It was an epiphany that, why am I embarrassed? Why can't I talk about it? If Bret was a young dude, and they said, if they're out there talking about it, I need to talk about it. And now, as Bret says, Mike, we can't keep you quiet about it now.
So now that you're meeting more and more men who have been hit with breast cancer, does it bother you that the predominant color is pink?
Breast cancer for men and women is not about pink balloons and ribbons and rah-rah. As you mentioned earlier, we're putting a splash of blue into a sea of pink. I would love for a ribbon to be unisex. This is a people disease, not a man's disease or a woman's disease. But pink, for a lot of people, makes it difficult to realize men can get this disease also.
Bret, let me ask you, I'm sure you go to a lot of races and try to stamp out breast cancer forever, and people likely think you're there to support someone else, right?
Absolutely. Yeah, the ones that we go to, and then I'll go and check in at their check-in desk, and I'll be like, yeah, I'm a survivor, and I kind of get that look like, are you? No, that's not possible and stuff. So I'll lift up my shirt and I'll show them the scar. I'll show them my tattoo that I got done on my side, and then they're kind of like, oh wow, that's amazing. Or like, I'm sorry, it's not amazing that you got diagnosed. I'm like, I know what you mean. I was like, thank you. So, yeah, it's definitely, it keeps people on their toes.
Like during the summer when you're out swimming, if somebody sees that scar, do they ask you about it? Are you open about it?
I guess most of the time, if I'm out swimming or whatever, I'm with a bunch of friends, so they all know and everything. But they like to crack jokes, and I like it. I think you have to have humor in it. If you don't have any humor along the way, it makes it really difficult to get through the whole process. With the diagnosis, with the treatments, everybody else around you feels to be on eggshells. They don't know if they're going to ask the wrong question. And upset you or whatnot. So as long as I'm open and willing to talk about it, crack some jokes about it, it lightened the mood.
Do you have children, Bret?
I do. I have she'll be 15 months in a week.
All right, congratulations.
Riley Sue.
Let's be honest, doctor. When someone has breast cancer, as a woman, we know their children are more at risk. Is it the same for a man?
Yes, when there's male breast cancer, then we worry more about the family having a genetic mutation that could be passed on. So genetic testing is very important for anybody with male breast cancer.
Here you are, Michael and Bret, warriors, streaked in blue, cancer survivors, smack dab in the middle of a global pandemic. How did you respond to all this now, even this many years after diagnosis? Suddenly there's no races to attend. There's no awareness events to go to. How did you respond to COVID and stay positive through all this?
Bret, you want to go first?
Yeah. During this, it was to take some caution at the beginning. Because as I said, if you're a cancer patient that you're more susceptible to it. So, take precautions when need, wear masks, gloves. And then just using social media to keep building awareness. In October, I'm trying to do my best to make a post daily or so about male breast cancer just in the month of October.
Michael, what was it like for you during COVID and staying positive?
Social media has really kept us through all of this. Posting Ford Warriors in Pink has been very instrumental in getting the message out for people. And besides that, my wife and I, we like to try to stay fit and active. We'll go to the park with a mask, socially distanced from everybody, but try to get exercise every day. And I just have to say my cooking skills have become amazing. I am now what they call a gourmet.
And during this pandemic, Michael, you actually took the bandana and made it into something so useful. Tell us about it.
Yeah, again, Ford Warriors gives us these amazing bandanas to hand out to the community to help give some more good days. And during COVID, it was so difficult to get a mask to go out into public, whether it was for shopping or go to a doctor or something like that. So they had put out an ask if anybody wanted some of the bandanas to help make some masks, and I jumped right into it. Have to be honest, I never ran a sewing machine before that time, and they shipped me some of these masks that I made scarves out of, some of these bandanas that I made masks out of, and also this pattern that they sent bandanas and I made masks. And on the sewing machine for the first time, I came up with one and they worked perfectly. I lace it up and they just look stylish. They help raise questions. And this was a sew mask as opposed to a no sew mask. And it helped raise the platform.
Hey, Doc, here's your chance to really speak to every single man listening. What's the number one thing you want to say to men when it comes to men and breast cancer?
Don't be afraid to show your doctor a lump or a spot in your aware of your body, and don't be afraid to show it to your doctor. And be proactive too. If your doctor, doesn't pay much attention to it, you maybe see a breast specialist who can do the appropriate testing and biopsy if necessary.
And Bret and Michael, to those who've already been diagnosed, what kind of strength can you give them?
Well, for me, I tell them You got to educate yourself. Knowledge is power. You have to sometimes be your own best advocate and try to use all of the resources that are there for you. And don't be foolish like I was in the beginning. Don't be embarrassed. Get out there, talk about it. You'll be amazed how wonderful people are at empathizing with you and talking about it to make you feel comfortable about it.
Bret?
That you're not alone. Once you get diagnosed, there are others out there. Michael and I are living proof, and we're here for you. The Male Breast Cancer Coalition is here for you, for your support and any guidance you need. If you don't feel that you're getting the proper treatment, reach out to us, and we will do everything we can to help you out. We've got doctors on our medical, advisory board that are more than willing to speak to your doctors in your area to help guide them and get you the proper treatment that you feel that you need.
Okay, guys, show off the gear you're wearing, because now I want to turn to everybody who's watching this conversation and say, help in the fight. Go to forwardcares.com, support the cause. Let's help warriors move warriors. Get them to their appointments. Work on wiping out any barriers to mobility. Michael Singer, Bret Miller, Dr. McCroskey, thank you for being so open and so authentic about male breast cancer. I'm Lila Lazarus. Thanks for tuning in.